Hello, it's me, Dr. Catherine Toomer, family medicine and community health physician and founder of Total Weight Care Institute, where I help people maximize their health and wellness through weight loss or weight care. And I teach other clinicians how to maximize their financial freedom and their time autonomy through comprehensive and compassionate weight care for their patients. And I wanted to talk a little bit about what's just come out with the American Heart Association, who has um, coined, well, actually has determined a syndrome. It's called the CKM syndrome, which is Cardiovascular-Kidney-Metabolic Syndrome. And what it entails is the risk of heart disease, kidney disease associated with metabolic dysregulation, including adipose or fat production or obesity. And so what they've done is they've squarely connected obesity to disease. They have squarely connected that cardiovascular issues and kidney issues and obesity issues are all tied together. And therefore, we can no longer claim that obesity is simply because people eat the wrong foods or they just don't exercise. I think anyone who studies patients, who understands the behavioral issues behind health and wellness, understand there's a biopsychosocial reason that behind everything that humans do. And so that also includes obesity or having obesity. What that means is that there's a biological component, which we know is metabolic. We know that hormones play a role in the production of adipose or fat, and that it's not the same for everyone. There's a genetic component to that and how our body responds to food. And so we've got a biological component, we have a psychological component, mainly because often with shaming and the way that we're treated within the medical community, it there's avoidance for one, and which of course makes anything else worse. But also, there's a certain amount of social currency around thinness, unfortunately. And so when you don't have that currency, often you're not treated very well, and that treatment gets internalized. And then you have your social, where we socialize around food, we get together around food. And so when someone is treated as though what they have, that their disease is based on their eating, then of course you become very self-conscious, it becomes very difficult, and then you lose that social connection. Then you start to isolate, which of course we know then feeds back into psychological issues, which then feeds back into biological issues. So it's all connected all together. And so what the American Heart Association has done is finally put it all together and said, yes, cardiovascular disease, kidney disease, and metabolic disease, including which obesity is, are all tied together. And that there are really good new measures for treatment. And what they're talking about are the GLP-1s. GLP-1 receptor agonist medications work on the biological, the cardiovascular, and the kidney preservation that we see in chronic disease. And so anyone who denies that these are that obesity is a chronic disease, especially if they're in healthcare, really is quite dangerous. I've actually heard clinicians say they don't believe in GLP-1s. I don't understand how you can't believe in a medication that actually treats diabetes. Now, we know diabetes is a disease, so how can you not believe in it? But to not believe using it as a means for preventing other chronic diseases or for treating a chronic disease, well, there's no room for not believing. Honestly, it's ignorant at best and it's dangerous at worst. So, thank you, American Heart Association, for stepping up and coining a phrase in coining a syndrome, which is exactly what it is, that we can focus on improving people's health and getting them better. And for anyone who is taking a GLP-1, pat yourself on your back for taking charge of your health and consider letting people know. I know that there's a lot of backlash towards people who are taking these medications, and but as long as we stay silent, as long as those of us who have taken charge of our health for whatever reason, using a GLP-1 medication like Ozempic, like Mounjaro, like Zepbound, Wegovy, Saxenda, or Victoza, or Trulicity, all those medications help improve health. And so by speaking up, it allows us to control the narrative, not controlled by those who are driven by fat phobia, who are driven by their biases, who are driven by their prejudices, because that's whose voice is heard if we stay silent. So again, I'm Dr. Catherine Toomer, and thank you for joining me. And I really hope that this resonates with someone. If you are someone who needs help or just feels like you're at the end of your rope and you can't, or you've tried everything and you just can't figure out why it's not working, please send me a message. There's always an underlying cause, and it's just a matter of finding that cause and going after that cause. And you can speak to anyone who's worked with me and they can tell you that I've often done this. This isn't something new. This is what I've been doing for years and years and years, and have been helping people lose their weight, because it's not about weight. Weight is a symptom, and we always go after the cause. And so that's what we've been doing. And so if you feel like there's something going on and you can't quite figure it out, send me a message. And the other is, if you're a clinician who feels like you're just fighting against a system that just isn't compensating you in the way that you should be, or is just treating you like you're another cog in the wheel, and you just want control over your finances, you want control over your time, then talk to me, and I can talk to you about what I did. I am a part-time clinician, and I help people with their weight care, but essentially weight care is health care. And so I go after the causes of weight gain, which is exactly the same as a lot of it is the exact same things we do in primary care medicine. But as a primary care physician, I wasn't treated as well as I would have liked. I didn't have control over my time. But what I do now is I work part-time. I am very well compensated for what I do, and there's nothing wrong with that. You can earn and serve at the same time. So if you're someone who wants to do that, contact me and we'll talk. All right. So again, I'm Dr. Catherine Toomer, family medicine and community health physician, and founder of Total Weight Care Institute. And thank you, Chris, for listening in. And as you always do, I appreciate it very much. Bye.